A new report highlights dangerous conditions at facilities known as surgery centers. These are outpatient locations where operations are done. There are 5,600 across the country. There are more surgery centers than hospitals in this country. USA Today Network and Kaiser Health News found more than 260 patients have died after surgery center procedures since 2013. Anna Werner has more on the investigation.
No, he's laying down and we don't with the IV and everything. I said, go get him, bud. That's the last thing I said to him.
Scott Van Veldhuizen expected his 12-year-old son Ruben would be fine when a doctor operated to remove his tonsils in 2016, until his mother Sandy says,
Our surgeon said this is not going well. She told us he had coded and they'd called the ambulance.
An ambulance, because the procedure wasn't done at a hospital but at a surgery center.
We were watching them work on our boy, and one nurse would talk to us, and then the doctor said it was done.
In the end, Ruben died. A Medicare inspection report showed a paramedic who arrived to treat Ruben received no response from the facility staff when she inquired who was in charge of CPR. After the family sued, the center and one of its doctors responded by saying Ruben's death was the result of pre-existing conditions, acts of others, or conditions over which they had no control or responsibility. But a joint investigation by the USA Today Network and Kaiser Health News suggests surgery centers aren't always ready for that kind of crisis. Reporter Christina Jewett.
We took a really comprehensive look at surgery centers and essentially when things go wrong there, what is going wrong?
Most people probably remember the case of Joan Rivers, who died after a surgery center procedure in 2014. This investigation discovered more than 260 people have died after procedures in surgery centers since 2013, some after routine procedures like colonoscopies and tonsillectomies.
The majority of the cases go great in these facilities, but what we found was that some of the patients are not appropriate for the setting. They might be too sick. Some of the surgeries might be too complicated, and we also found that sometimes the centers just aren't prepared.
But the group that represents surgery centers says
this report is doing a disservice to patients.
Bill Prentice with the Ambulatory Surgery Center Association says data backs up the center's safety.
If you took that wider view and looked at the number of adverse events that happen in hospitals compared to surgery centers, you'd see that we're in actually a very safe site of service.
There are risks associated with any procedure. If you're considering a surgery center, experts recommend asking about backup plans in case something goes wrong and looking at how far that center is from a hospital. And if your underlying health is poor, you might just want to have that procedure, Jeff, at a hospital.
It's interesting. We called it routine surgery. Some people say there's no such thing as routine.
And they're doing a lot more complex surgeries at many of the surgery centers, too. So that's something to keep in mind.
Absolutely. Anna, thank you very much.